It's been 5 months since I last saw my husband, João. He is currently alone in our apartment in Newark, New Jersey, while I'm staying with my parents in Arinos, a small town in the state of São Paulo, Brazil. Due to U.S. immigration procedures, we had been in long-distance relationship mode even before COVID-19, but at least the situation was eased by the perspective of him visiting me in Brazil every 3 months. Then, the pandemic hit, and his plans of spending Easter in Brazil were abruptly shattered. We suddenly found ourselves heavily quarantined in our respective homes, hoping that this would all be over before summer. Now it's June, and we have been pondering whether my husband should make his way down to Brazil for a summer vacation. How risky would it be for him to go through the hurdles of airport security, and then board a likely crowded plane to land in São Paulo 9 hours later? João and I are far from being the only ones facing this dilemma. Many people wonder whether they should board a plane and travel this summer. Here are some of the things we've learned that might help you make an informed decision. If you're traveling internationally, find out where you're allowed to fly from, and to Brazil has currently the second highest number of COVID-19 cases in the world, and the numbers are going up fast. President Donald Trump has recently issued a travel ban on most travelers coming from Brazil. This leaves us with yet another preoccupation. If João is, in fact, able to come, will he be able to go back to the United States? The same question goes for other destinations subject to suspension of entry to the United States, such as China, Iran, the United Kingdom, Ireland, and most other countries in Europe. If you are not sure whether there are COVID-19 related travel regulations in place for your destination, you can access an interactive map on the website of the International Air Transport Association (IATA) Travel Center. Just click on any country to find out about possible restrictions. The U.S. State Department's Bureau of Consular Affairs also keeps a color-coded map that shows the latest U.S. travel advisories for every country in the world, including, but not limited to, COVID-19 related recommendations. In addition to this, you can subscribe to a service, the Smart Traveler Enrollment Program (STEP), to receive the latest travel advisories and local safety and security information for your destination via email. The general recommendation on international travel issued by the Centers for Disease Control and Prevention (CDC) is to avoid non-essential trips, and the agency cites that many countries are implementing travel restrictions and closing borders with little advance notice. For domestic travel, there are no restrictions in place, although some states may require out-of-state travelers to complete a 14-day self-quarantine, such as Maine. The CDC advises domestic travelers to check your destination's state health department for up-to-date guidance. The fact that we have not seen large groups being reported as having exposure occurring in flight is quite reassuring. Don't let the antibody test result make a decision for you while mulling over the risks of an international trip amid a pandemic. João considered how convenient it would be if he was already immune to the new coronavirus. He decided to take an antibody test, once that became available at the local CityMD. The test came back negative. For what it's worth, a positive result wouldn't have guaranteed a risk-free journey, either. Results can be a false positive or a false negative, and even if the result is accurate, I think it's yet to be proven that a positive result of an antibody test in humans implies true immunity to infections, says Dr. Henry Wu, director of the Emory Travel Well Center and assistant professor of infectious diseases at Emory University School of Medicine. It's also not proven that being positive for antibodies means you've fully recovered and can no longer transmit the virus, he added. Know what you're in for before boarding the plane. It might not be as bad as you think. At first sight, a plane would seem like the perfect incubator for the novel coronavirus, with dozens of people sharing a small space without the possibility of opening the windows. But it turns out that the plane's ventilation system probably makes air travel safer than spending 9 hours in an office, for example. The filters used on planes, called high-efficiency particulate air (HEPA) filters, are supposed to take out a large proportion, beyond 99%, of infectious pathogens. According to the CDC, most viruses and other germs do not spread easily on flights because of how air circulates and is filtered. In fact, there are very few reports of respiratory infections in general proven to be acquired on planes. During the 2003 SARS outbreak, another severe acute respiratory syndrome also caused by a type of coronavirus, biologist Luciano Kleber de Souza Luna and his colleagues at the Bernhard Nocht Institute for Tropical Medicine in Hamburg, studied passengers arriving in Germany after intercontinental air travel who developed symptoms of SARS. Researchers tested their samples for different types of viruses and bacteria and found that almost half of them had one of the pathogens. Interestingly though, the infected patients were all scattered on different flights. We couldn't identify any cluster of passengers with the same virus on the same flight, said Luna. This suggested that the infected travelers probably didn't acquire the pathogen during the flight nor transmitted it to their fellow passengers on the plane. When it comes to COVID-19, although there's no hard data, there is no strong evidence of transmission aboard an aircraft. So far, I haven't read convincing reports that confirm that it has happened, said Lin H. Chen, president of the International Society of Travel Medicine and associate professor at Harvard Medical School. The fact that we have not seen large groups being reported as having exposure occurring in flight is quite reassuring. Otherwise, I think we'd be seeing many clusters of people who, say, land in Boston and all come down with coronavirus after their travels. Be careful with publicly used items such as tray tables, seat belts, seats, and lavatory doorknobs, Chen says, and clean them with sanitizer wipes. Protect yourself before and during the flight. In light of the pandemic, airlines are implementing new safety policies, such as making efforts to limit the number of people on board and block middle seats, loading planes back to front to limit contact among passengers, and intensifying cleaning procedures. Delta Air Lines, for example, announced it will be reducing the total number of passengers in the main cabin to 60% through September 30. United Airlines stated that it will do their best to contact passengers 24 hours before departure in case their flight is expected to be fairly full. These passengers will be able to change their flights with no fee. But there are other measures travelers can take to protect themselves before and during a flight. Passengers should be alert from the moment they get to the airport, as they will face check-in, security, and boarding lines which might bring them in close contact with other travelers and shared objects. Remember to always stay at least 6 feet apart from other people and use hand sanitizer after touching surfaces like check-in kiosks, luggage trays, and carts. These are basically the same precautions you would take in a supermarket. The CDC recommends that everyone wear a cloth face covering over their nose and mouth when in public, including during travel. Wearing disposable gloves, on the other hand, might not be such a good idea. I don't routinely recommend gloves in most circumstances. And the reason is, even if the gloves protect your hands from any finger touching a contaminated surface, the gloves themselves are contaminated now, Wu said. After boarding, pay attention to where you're sitting on the plane. If you are lucky to get on a plane that's not full, certainly the airlines are taking every effort to keep passengers as spaced out as possible. However, I have already talked to a number of travelers who have been on flights that were full, said Wu. So, the possibility of a relatively full flight is real, to the point that you may have somebody next to you or in the seat right behind or in front of you. That's potentially a problem, because even an efficient air circulation and filtration system might not protect you if someone sick coughs or sneezes in your close proximity. That's why it is so important for all passengers to wear a mask during the whole flight and intensify the application of other protective measures that are already advised on land. The most important ones are to avoid touching your face and practice careful hand hygiene. I would advise all travelers to carry with them a small supply of hand sanitizer, and I would actually carry it in my pocket. You want easy access to it at any point during the flight, said Wu. Although hand washing is generally preferable, Wu said it's probably not a good idea to get up to go to the lavatory just to wash your hands on the airplane. You'll probably risk contaminating them on the way back. Be careful with publicly used items such as tray tables, seat belts, seats, and lavatory doorknobs, Chen says, and clean them with sanitizer wipes. So many people have touched these along the way, and it may not just be the SARS-CoV-2 we are reducing the potential exposure to, but other microorganisms as well, said Chen. When you're visiting family from a different city, you are introducing a potentially very different disease risk. Don't worry about airplane food. My husband and I also wondered about eating on the plane. One consideration would be to just bring your own food and pass on anything that's being handed out, says Wu. However, the major airlines are developing protocols to minimize the risk of contamination of food, and obviously their crews are being advised to use strict hand hygiene, as they always should. Also, according to the CDC, there is currently no evidence to support the transmission of COVID-19 associated with food, so passengers should feel reasonably safe eating the airplane food, as long as they use hand sanitizer before and after the meal. Be mindful when you get to your final destination, even if travel is not restricted from one particular country to another, or if quarantine is not mandatory in certain areas. It's important to be mindful of your loved one's health and recognize when you might be putting them in unnecessary risk. When you're visiting family from a different city, you are introducing a potentially very different disease risk, Wu said, adding that if you need to visit family from different areas, it's important to maintain distance, use masks or face coverings, and intensify hand hygiene. I share the frustration and challenges because my own parents are very elderly and live in a different state. And as much as I would like to visit them, I also recognize that as elderly persons with other medical conditions, it would be extremely dangerous if I were to inadvertently infect them during my visit. As some countries start to reopen while others have growing rates of infection, it gets trickier to provide updated recommendations for travelers about what precautions they should take at their destination. As a rule of thumb, social distancing should be practiced everywhere in the world at this moment, according to Chen. If you have any symptoms or believe you had recent contact with someone with COVID-19, consider getting tested right before deciding to travel. Contact your local health authorities to check if you are eligible for free tests. In New York, for example, the test is free if you go to a test site run by the state. A final thought: air travel, or any travel during a pandemic, isn't risk-free. Even without a lot of confirmed case reports, I think the traveling public should assume that there will be some risk. Even if it can be mitigated, the chances are that it cannot be completely eliminated, said Wu. For the moment, my husband and I decided to wait a few more weeks and watch how the pandemic evolves in Brazil and in the United States. If he does not come over this summer, it is unclear when we'll be able to see each other again.